What we're seeing is steady numbers in the last few days, but now across the country we've got 87 cases of coronavirus diagnosed in the past day. That's a very high number compared to what we're used to seeing. Partly it's been pushed up by 14 cases out of New South Wales. Before you worry about that, that is a big number. They are all overseas arrivals. They're all in hotel quarantine, and unlike Victoria, we haven't had any leakage of the virus outside these hotels, so fairly confidently can say that they're fairly low risk at the moment. But this 73, let me just show you on the chart where that sort of sits compared to the last few days. We're seeing basically for 3 days now relatively flat numbers. Does that mean we are at the end of this growth and we're cresting and perhaps Victoria's on the way down? I don't think we can necessarily say that yet. It is heartening to see that the numbers aren't continuing to go up, but just remember, you know, earlier this week we saw a couple of days of cases in the 30s, and then last week we were seeing cases stubbornly in the high teens, low 20s, not really moving up or down. So it's not inconceivable that it will level out for a little bit and then rise again. That's a totally believable pattern that we might see. It also, you know, there's a lot of factors going into that drive and influence these numbers, including not just the testing rate, which has gone up, but also which particular suburbs are being targeted on a particular day in this door-to-door testing blitz. And if authorities happen to target, say, a suburb with higher levels of virus in the community, well, then the numbers will necessarily be higher. So let's just wait and see what happens through the rest of this testing blitz. But certainly, we're not going up. We're not seeing numbers get into the hundreds, and that's a good sign.
Okay, so there's a growing concern in the US about the rate of infection there.
Yep, and the United States is now just clearly setting records again. Actually, let me show you this. Let me show you this chart. The United States was the first country to see a very serious outbreak. It's currently seeing numbers worse than even the first time around, almost 40,000 cases a day. It's now really clearly overtaken Brazil with 37,000 cases a day. And again, it's still this regional pattern that we're seeing. I just want to show you this chart showing you some of the states in the United States. I've added, I haven't been showing New York for a while because it tends to push all of these states further down, but New York was obviously the worst hit state early on. What we're now seeing is Florida, Texas and California. The numbers there rapidly rising, and together they are more than Florida ever saw, more than New York ever saw, and they're rapidly approaching this. Florida has had individual days at this height in terms of the number of cases and infections it's finding. So things are rapidly getting worse there. Anthony Fauci, the medical expert advising the White House, has said today that cases could hit 100,000 a day. Certainly possible. You'd hope that things would be reined in before then, and we're not in danger of the US hitting 100,000 anytime soon, but it's certainly a possibility. And we've seen how quickly these numbers can grow if things are left unchecked. The good thing, though, is that we are seeing that the death rate is considerably lower at the moment in the United States than what we're used to seeing. Part of that is that the profile of people being infected is still younger than it was the first time around. There are less nursing homes that are the source of clusters, but will that stay that way forever? The more viruses in the community, the higher risk it gets into these high-risk populations.